WIC is one of our largest local programs, and we very often educate on healthy lifestyle behaviors. Those behaviors that we're educating on with our WIC families are the behaviors that we actually want everyone to practice locally. Referrals to our local food pantries are actually one of the most common referrals our WIC nutrition educators coordinate, so it made a lot of sense for WIC to look at our local food pantries and actually increase the amount of healthy options that were available there.
We've been targeting organizations who we know host their own food drives and providing them with promotional materials that outline what the healthy donations are for local food pantries. The local food pantries are essential for our community, and we want to get healthier options in there so people can make healthy choices.
We're very excited at the food pantry to be a part of an initiative by the Clinton County Health Department, which is to promote and encourage healthier choices of foods in the population. People coming to us looking for some assistance, even though they're hungry, we're not just going to give them 20 cans of SpaghettiOs or 13 cans of soup or anything like that. We're going to make certain that they get a balance in the different nutritional groups.
We have WIC clients that come in who don't always get the amount that they need of formula or fruits and vegetables or milk to last them the whole month. Our clients walk out of here on a daily basis with at least a bag or two of produce that they wouldn't be able to normally bring home. If a family comes in and they tell me that they don't receive WIC, because I asked that question, I will refer them to the WIC agency.
I think WIC is such an important program within the community that having them part of the coalition that oversees the Community Health Improvement Plan is significant and has actually elevated WIC's presence within the community.
So what we're doing is we're having breastfeeding be a component of our work with our local eateries. So in order to become a Better Choice eatery, they have to pick 3 recipes that are healthy for individuals. They have to follow our environmental standards, so their food service inspections have to be positive. And then they have to pick additional healthy behaviors. So what we did was we worked in the breastfeeding decal. So if an eatery picks the breastfeeding decal, they get 2 points. We want them to get up to 5 points in healthy behaviors. We're trying to really get this message out to normalize breastfeeding and to show the support within our community.
I had my first child when I was 18 and really didn't have much of a clue. So WIC was very accessible, educated me on how to nourish my baby. You know, it's really high time that we feel comfortable feeding our children. So I'm really happy for WIC to help promote breastfeeding in public places. And I'm hoping within 10 years, nobody thinks anything of it. It's just, you know, they're feeding their babies.
I believe it's the most natural thing to breastfeed a child. Therefore, whether you do it at home or in public, there shouldn't be any problem whatsoever. My hope is, as a parent and as a business owner, that we can come to a point where women do not feel uncomfortable to breastfeed in a restaurant or in any public area.
As a mom, one of the biggest concerns I had when I was nursing was, is my breastfeeding going to make somebody else uncomfortable? And I think one of the things that comes with more acceptance and more, I guess, understanding of it as a whole and how natural it is realizing that it's all about health and happiness and quality of life. And those are the things that I think nursing promotes.